was very fascinating and interesting, but it was challenging too, because I didn't know what kind of platform they were creating. But once the application was ready and when I saw the application, I mean, I was perplexed. This is what we need. I think this will address the very need in the healthcare society this day. I've been in practice in US for 20 years, and I have to tell you the truth that the technology, the expertise, and the medications, everything is available in India. This is not any different from the Western world, and it is on par. But how we deliver it to the people makes a big difference between here and the Western world. There, I mean, besides Murli and Vivek, and they were addressing how to take care of the elderly, because this problem is coming here. This is new here, but this has been an age-old problem in the Western world, where older generation people either live on their own, debilitated, or live in a nursing home. But here, because the modernization and increased working, both the wife and husband are working, so we have less time available for the parents. So this tool will really be a great help for home health care. It's not for only elderly, but I've seen, for example, I do chemotherapies and patients go home after the chemotherapy, and one of the biggest problem is post-treatment complications, either after surgery or after chemotherapy, after a fracture, after any other major health issue. When patients go home, they're in a very labile situation and they can run into problems, and then when they get re-hospitalized, that's humongous expense. So what this home healthcare delivery system, which includes all the various components like physical therapy, nursing care, and others, does is make sure that there are no complications developing, and then address them ahead of time. So in fact, it will lower the cost of the patient and also improve the quality of care. And in fact, I can say that we cannot function there without the help of these home care systems in US. So I see a very huge potential. When Vivek said that his target is $1 billion, I mean, I'm sure you might be thinking that it's a huge target to achieve, but I can assure you it is not. It is very easily achievable, because healthcare needs is a need of every human being. As long as we live, we have problems and we have needs, and this will be very easily addressed by this tool. And I don't know if you all had a chance to look at the tool, because we're only addressing the home health system right now, but it's got several other components of the healthcare delivery, which we have not talked here, but it is a wonderful tool. And I kind of whenever I show it to my colleagues or other people, and I mean, there's a humongous interest in the medical community back in where I practice, and it's going to be pretty sure a tool of choice back down there where I practice. Even though we have few others, but there's no tool that is addressing all the aspects of the healthcare delivery system. So thanks to all the technical team and the brainchild Sujit, who's created this idea, and I wish them good luck, and I'll continue to support and promote, and I wish them good luck.